Bone marrow donation, the challenges of finding a match. Imagine needing a bone marrow transplant and wondering how hard it is to find someone with the right immune system markers to help you. It's not as simple as just asking anyone. The immune system uses special markers called human leukocyte antigens to tell cells apart. For a transplant to work well, the donor and recipient need to have very similar human leukocyte antigens. If they don't, the new immune cells might attack the patient's tissues, causing a serious complication called graft-versus-host disease. Human leukocyte antigens are proteins on the surface of cells that act like ID tags. Everyone inherits a unique set of these tags from their parents. Because of this, the chance of finding a perfect match outside of close family members is quite low. Usually, doctors look for a match on 6 to 8 specific human leukocyte antigen markers. Even if they find a perfect match, other genetic factors can still cause immune reactions that might complicate the transplant. The best chance of finding a match is within a patient's family, especially siblings. Since each sibling has a 1 in 4 chance of sharing the same human leukocyte antigens, only about 30% of patients find a match this way. For the remaining 70%, they have to turn to national or international registries of volunteer donors. These registries hold millions of potential donors, but they still only representing a small part of the world's population. This means some patients might never find a compatible donor, especially if they belong to minority groups. Race and ethnicity play a big role because human leukocyte antigen types vary among different populations. People are more likely to find matches within their own racial or ethnic group. Sadly, fewer donors from minority backgrounds are registered, which makes it harder for patients from those groups to find a match. Younger donors are preferred because stem cells from younger people tend to lead to better transplant outcomes. Donors are usually between 18 and 35 years old, but older donors can still help. The process of donating involves either collecting stem cells from the blood or extracting marrow directly from the bones, often from the pelvic bones. Finding a compatible donor is a complex process because of how unique each person's immune markers are. Limited diversity in donor registries, and the fact that many people don't register as donors make it tough. Efforts to increase the number of registered donors and improve diversity are ongoing to help more patients find the right match. The more people who join donor registries, the better the chances for everyone needing a life-saving transplant.